Local programming on KRWG made possible in part by viewers like you. Thank you.
Suicide impacts all of us New Mexicans disproportionately, with the state's suicide death rates being at least 50% higher than national rates, according to a New Mexico Department of Health study from 2014. According to New Mexico's indicator-based information system, suicide was the 8th leading cause of death in New Mexico and the 2nd leading cause of death for those between 15 and 39 years of age in 2014. Our guests today are here to discuss a new task force that involves the City of Las Cruces and several community leaders. Dr. Satya Rao is a professor at New Mexico State University and is chair of this new task force. And Sandra White is vice chair of the task force. Welcome to Fronteras, a Changing America. Thank you for joining us to discuss this very important subject.
Thank you.
And it's a subject that carries a lot of stigma with it. It's not a subject that people have casual conversations about. Let's start by discussing how this task force came to be and what kind of involvement the City of Las Cruces had with this task force.
You know, this task force started as a consequence of one of our city councilors. Cassandra Gondara, who joined the city council recently, has been extraordinary in terms of being a social worker. And so she has seen in her work that suicide was impacting a lot of families. She got in touch with some of us, such as myself and Sandra, and she also talked with the mayor and the other councilors. So it is a partnership between the councilors, the city, and citizens in Las Cruces. So we are very excited about that.
How unusual is it, Sandra, for a city government to take this kind of leap of faith and want to be involved in discussing this issue, because it's not something that across the country that you see very often, but yet here we are in Las Cruces where it's being discussed?
Well, I believe it's because not only did we lose a city councilman, but we also have had the same suicide impact us individually. I'm aware of Cassandra's personal story was one of her close friends also had completed and ended her life through suicide. And then, of course, it was our former councilman, Miguel Silva. It was timely because both of those deaths happened within a very short period of time of each other. And I believe that actually having Cassandra Gondara on the city council as a social worker, social workers look at lives differently, look at situations. We're looking for solutions. When something such as a suicide, a shooting, something that hurts our community, whether it's just one loved one or a family member or as a whole, social workers go to action, and it's a call to action. And I think that's, unfortunately, we want to ensure that these individuals did not lose their life in vain, that something is made aware of it and it's bigger than just one person's life.
When it comes to suicide, I think we've all been impacted, and you know, you often hear that person was such a happy-go-lucky person. They were very joyful, always wonderful to be around. In the example, in the case of Councilman Miguel Silva, which he had huge involvement with KRWG, and we would constantly see him around, and you hear about this, and there's such a great impact that you want to talk about it, but at the same time, what's the comfort level to discuss this?
You know, I think that stigma is a big issue as far as suicide is concerned and mental health is concerned. People are scared. People are fearful because suicide doesn't happen to too many people. Unfortunately, it is a significant but a very select group of people that are impacted directly by suicide. So our job is really to talk about the lives of these people, whether it is Miguel Silva, whether it is a kid in a high school, whether it is a lawyer, whether it is a councilman, whoever it is. The fact that they ended their lives to suicide is a shock, is frightening, is scary, and so people really have difficulty communicating and talking about it. It's this dirty secret that we all keep and are scared to share because we think that maybe other people will not care about us anymore. So this particular task force is really focused on creating a compassionate community in Las Cruces and to allow for that safe zone, safe space where we can actually have a conversation or even ask a question. How do I talk to someone who says that they're going to end their life? And that's important to do that. And you know, reducing stigma is a work in progress. We have to do it on a regular basis. And you know, we on the task force really think that we can make a difference because we are a collection of professionals and lay people, citizens in the community who have been impacted by it. So our job is to really make sure that we start that particular conversation and make a difference.
You know, when it comes to looking at it in terms of it being the second leading cause of death among people ages 15 to 39, it seems that when suicide does happen, it becomes a secret for some of these family members that they're not comfortable really talking about what happened. How will this organization, this task force, go about letting people know that it's okay to talk about it?
You know, part of that, I think, go ahead.
Well, first of all, one of the things that we are going to do to bring it to the attention of community members is we're going to be having dialogue with City Council. Okay, and everyone's invited, and that's going to be on August 22nd. There's going to be a work session with City Council. We'll be doing some presentations, but the community is invited, and it starts at 1 o'clock at City Hall. So that's kind of going to be our kickoff as far as that goes. But those conversations and the information that we would like to get out either through PSAs, one-on-ones, trainings, whatever we join with other organizations who we believe September is Suicide Prevention Month. So mental health organizations will be promoting mental health awareness and suicide prevention, suicide help, where to go. So we're going to partner with them. That's one of the things we're doing. But the kind of conversation we'd like to have is provide trainings where if one of the family members say, I just feel like ending my life today, and they're serious, that the person has enough information that if nothing else, where to call. Because unfortunately, sometimes we're scared and we call the police. And maybe that police might be secondary to getting professional help out to talk to someone. Or if you can get them willing to go to a facility that provides an assessment. But to be able to have that first dialogue as to what do I do? How do I respond? And that's going through some trainings and starting the dialogue to talk about it. This is what you can do. You know, we're here to help you, or you can call. You know, but when they don't even have a clue, it was interesting on our first meeting. Do you remember this, Satya? Another city council person was there when we were planning the task force, and we asked her, just asking her what would we do, and she had no idea. She had no idea. She's like, oh my, I don't know.
And I think that's so common, especially if you look at parents who might have a teenage child whose parents might assume they're going through the teenage years, they're just being moody and dark. But, you know, how do parents deal with this? You know, what will this task force in the city do to help educate parents to have, because there's nothing worse than hearing from a parent that I didn't know my child was undergoing this kind of depression, this mental health.
English.
How will you go about to get the word out? Because I think that's the biggest challenge. I mean, we've got this program here to help start that. But you know, in addition to that, how will you go about getting the word out about suicide prevention?
You know, one thing very important is that the task force has members who work in various types of organizations, social services, universities, citizens, all of those folk are on this particular task force. So each of us takes it upon ourselves to actually start raising awareness in our own communities. Many of these folk are already doing that. We have someone from the religious community, pastors. So religious community is another place where I think the importance of suicide prevention is very critical, because a lot of people actually go to their pastors to say, you know, I'm at the end of my situation, I don't know what to do. So pastors are very important, healthcare providers are very important, social workers are very, very important. So our goal is really to do very intentional awareness raising among these professions who are going to make a difference. And then as that kind of seeps into the community, we can see that more and more people can get involved. It's going to be a labor of love for a long time, and it's not going to change just immediately.
It's not an overnight issue,
Yeah,
because
no.
again, this again involves,
Yeah,
number one of the things you're working on is education and training
right.
of professionals, but also of citizens.
Yes.
How would you go about doing that?
Well, we're hoping, and this is, we believe that we can start off by educating and training the individuals who work for the City of Las Cruces. You know, when you start working at New Mexico State or wherever you work, there's job training. And there's continued training, and every 6 months training, and computer training, and health insurance training. Well, what about suicide prevention training or mental health awareness training? So that if a coworker or a family member does start displaying signs of distress, one of the things that when somebody is contemplating suicide, they start giving their things away. Okay, just little hints that they're planning this. They might seem more depressed, more withdrawn than usual. To be able to have that comfort zone to say, is everything okay?
Yes. Right.
You know, what's going on with you? Because we do have those small little relationships at work, you know, that maybe that can be a starting place. There's quite a few employees with the City of Las Cruces.
How will the City of Las Cruces work with the police department and training police officers on how to deal with somebody that might be suicidal?
You know, I think the logistics of what we are going to do in terms of training and education, we've not completely worked out. That is one of the presentations that we're going to make on August the 22nd in our work session, to really get the city and the leaders of the city vested in helping us with the training and the education. So, but I know police departments do get training. The sheriff's departments do get training, but the idea for us is to really know what resources do we already have in this community, and where are the serious gaps, because there certainly are gaps. And our job as a task force is really to kind of focus on those gaps and to kind of make this suicide prevention a seamless process, so that nobody falls through the cracks. And that's what a lot of times people who have attempted suicide have told us, that they've gone to get help somewhere and it didn't work out the way they wanted, and so they kind of moved away from getting help from other resources. So our job is to really make it a compassionate, safe place where people can actually go and ask for help. And our job as professionals and as city councilors and others in the community, leaders in the community, is to really fill those gaps and to make sure that it becomes easy to ask for help. And it is non-judgmental when people ask for help. It's not a reflection on their capacity in any way. And that's something that we have to constantly do, and we as a task force are really working very diligently to get our members to do that.
But I do want to let you know there is a crisis line, and I
Yeah.
believe it's been shared with you. But if you call the crisis line,
Yes.
that you have an individual there, or they themselves are in the process or attempting, they will also contact police, and they go together.
Right.
So that it's a lot, the environment is kind of more de-escalated than a crime scene. So, you know, I've used that service for some of my clients, and it has been very successful. And that they
helpful,
actually
yeah.
did not complete suicide and received the help they needed.
Let's look at the challenges that we face today, and that's resources. How would you go about to advocate for resources to either fund this program, to bring people together, to make sure that there are enough people involved so that this program succeeds?
Right. Of course, resources are such a big issue, you know, on every level, particularly fiscal resources. One of the things that we are looking at very seriously is to start looking at grant funding. There are organizations like the American Foundation for Suicide Prevention who give out grants specifically for events, for activities such as what the task force is thinking about, education, training, etc. We are also going to present to the city and the city council to really see what they can do in terms of fiscal resources, providing with some seed money or whatever it is. It's up to them. We have not had a conversation with them, and we are hoping that we can leverage our capacity, our equity, our sweat equity and capacity with their fiscal resources.
A lot of this does involve sweat equity.
Yeah, I call it human capacity, because every person brings something to the table, regardless if it's just the individual that said, hey, I want to hear what you have to say. Once they hear what we have to say, they've learned something. And so if they're ever with an individual or have ever felt that way, they learned something. So I think a lot of it's going to be relying on concerned citizens. And I believe that Las Cruces has a lot of individuals who care in the city and, well, statewide. But, you know, it has to start small, and then we can grow out.
Let's name names. Who is involved with the task force? You know, what organizations have come forth and said, count me in? Okay. What individuals? I know Councilwoman Gandera stepped up and said, count me in. Mm-hmm. She was one of the first people to do so. But who else is involved in this organization?
You know, Councilwoman Olga Pedrosa is involved, Jeannie Resendez, Margaret Short.
Okay, so that was from Mesilla Valley Hospital, Memorial Medical Center, and the Spiritual Pastoral Group. Then there's La Clínica da Familia. They have two individuals, Patricia Gonzalez and Mari Jimenez from United Healthcare. I'm going around the table that day that we met.
Exactly, that's the best way to do it.
And you know, Chelsea Cannon, she is a student from NMSU. We have Olga from the social work, Olga Cabada.
And then we have from Community of Hope, the Veterans Center.
Yeah.
Gosh,
now,
Margaret. Ooh, I'm terrible.
Is this something that you will also bring to the public schools? Because as we know, again, it affecting youths, you know, very at the age of 15, if not younger. Is this something that you're looking to bring to the public schools as well?
Absolutely.
Talk about our member from the public schools.
Yes, we have a retired teacher from the public schools. She is extraordinary in terms of having worked with students for such a long time, and she also lost her own son to suicide a year ago. So her interest in suicide prevention has been extraordinary. And she's one of the people from the schools who has been from the very beginning so interested. We are talking to counselors and therapists from the school district to become part of this particular task force. So I think that the schools will be well represented starting next
Good.
meeting. So, and we recognize that young people in many ways have dealt with the burden of this particular issue. Their concerns sometimes are not heard as well as they should be by adults. And I think it is important to allow them to talk about their challenges and their struggles.
How do you, as a task force, go about working with these groups, these organizations, on helping reduce stigma and secrecy surrounding suicide, and in particular, of course, mental health, and getting the word out of the different organizations that are available to them where they can go for help?
Right. Stigma and secrecy are the two issues that kind of separate mental health from some of the other health issues that we are familiar in New Mexico. For example, diabetes or heart disease. That kind of a conversation is quite different than the way we talk about mental health and suicide prevention. One of the important things about reducing stigma is not being afraid to speak. Those of us who have experienced the suicide of loved ones should not be scared of talking about it, and not being scared to talk about the aftermath and how important it is to work through those issues to be able to help ourselves and help others. So one of the important ways in which stigma can be reduced is that intentional conversation that we need to have, and that fearless conversation that we need to have.
And I think that just starting the conversation, just asking about it, bringing it into the workplace. We spend a lot of time in the workplace, and we're going to most likely be trying to get, once a work session happens, trying to get more organizations to talk about it. Not just mental health organizations, because talking about it in a mental health organization is their work.
It's a common conversation.
Right,
but
it's
to have
a
this conversation, how will you go about spreading the word into, private businesses? Is this something that it's important enough to bring to some of these private businesses that might have 5 or more employees to come in and offer a workshop or a seminar to say, this happens and here are some things to look for?
It's an issue of quality of life, first and foremost. And second thing is, it's really, if you look at cost analysis, if you can help someone early on with their struggles or with their concerns or issues, we can see that they become very productive and they continue with their jobs and continue with their work. So it's really about showing people the economic impact of early intervention. And that is very, very critical. It may sound sort of unusual to talk about the economic benefits of these kinds of interventions, but to do that really helps us to bring the issue and frame the issue to private organizations and businesses. What is it in for them if to do this particular training, to do this kind of education for their employees? It is for their well-being, and it keeps people working productively for a very, very long time.
The other thing that we have is we have some great partners that are already trained in 2 to 3 evidence-based curricula based on their age, their culture, gender. And so having that as part of our task group to start off with, we don't have to go out and find individuals or pay individuals to train us to train others. So it's just starting with what we have. I think you said something real important, Satya. What do we currently have as resources in Las Cruces? Who can we call to say, we have 3 businesses that are interested in doing a presentation. Do you have a trained individual to go? And is that communication, the dialogue, in getting this going for the city. And like I said, and there are organizations, you mentioned a few, the New Mexico Crisis Hotline and the peer-to-peer warm line. You know, those are easily accessed resources that we can call them. They come into the community and they do trainings if we can't find somebody locally.
Looking at the needs of the task force, you're obviously looking for some foot soldiers to go out there and help spread the word. When you reach out to these foot soldiers, I mean, what's a good way that they can contact the task force? Is it a good idea to go through the City of Las Cruces to Councilwoman Gandera, or how can they get involved?
I mean, Councilwoman Gandera is, of course, a very good source to call her office or send her an email. As I had indicated, I have my NMSU email address as well as a phone number that I suggest that people can call. You know, in the last 10 years, I've used that particular phone number, and I think at least 60 to 70 people have called me just to find out about suicide prevention.
Dr. Rao, Sandra, thank you very much for coming into Fronteras and Changing America and talking about this important issue that affects our community, affects our entire country.
Right.
Thank you very much for your time.
Thank you, Edmundo.
For KRWG and Fronteras, a Changing America, thank you for joining us. We'll see you next week.